video is the one and only Dr. Geri Weiland, pediatrician, immediate past president of Mississippi State Medical Association. Good morning and happy Thanksgiving.
She was laughing at us earlier.
Good morning.
Well,
good morning.
She was laughing with us this morning. That's
okay.
it.
Have I aged out?
I'm allowed to do that, huh?
Yes. Have I aged out? Would you treat me for my knee issues?
You would be surprised the number of adults I treat. So.
Okay, good.
Well, if they just hang around enough, I mean, they'll go diaper to diaper. So just be patient. Yeah. Here's a quick shot that will interest you. 2-year-old Oregon kid was so pale the doctor suspected he had blood cancer. But after a comprehensive blood panel, his diagnosis was changed, and here was the problem. He was just white as snow. Laura Donovan's son, Johnny, started drinking cow's milk, a year old, but by the time he was fatigued, fuzzy, and more prone to tantrums. Why did cow's milk cause the problem? Because it hurts the body's ability to absorb iron, but apparently this guy was drinking an unusual amount. A test showed that Johnny's hemoglobin level was only half of what it should have been. Doctors recommended 16 to 24 ounces of cow's milk a day. He was drinking 30 to 40 ounces a day for a year. So one of the reasons we have pediatricians out there is so important. So have you ever seen anything like that?
Oh, it's more common than you would think. Yes.
Really? Yeah.
Yeah. It just causes anemia. It's treatable, but yeah, it's one of those things where there you can get too much of a good thing.
Probably the same thing with orange juice or Coca-Cola for that matter. I had a story.
Well, orange juice doesn't make you anemic. But...
Well, no, not anemic, but I mean you can have too much of a good thing. Labatters Children's Hospital Pediatric Intensive Care Unit. And this is a couple of weeks old here, reached their capacity, limiting bed availability. More children were being tested for respiratory viruses. Hospital's medical director of infectious preventionist, Nick Highsmith, said the hospital finds itself stretched thin on beds. Where are we with this RSV, Doctor?
Well, RSV, respiratory syncytial virus, comes around every year, as does the flu. They kind of go hand in hand with other respiratory viruses. In Mississippi, we had a huge peak actually a couple of months ago, and the pediatric ICU at University Children's Mississippi was strained, and they did have some issues with capacity, but they were able to work through it. They are not seeing as much RSV right now. We saw tons of it in our clinic just a couple months ago. We're seeing a lot of influenza. And I know we're talking about RSV, Paul, but I'd like to say right now we're seeing influenza. We're seeing it in young people. We're seeing it in old people. And the great thing is we have a vaccine that has been out for years. You have to take one every year because your respiratory syncytial, any respiratory viruses, you don't get good immunity forever. So you have to boost. But anybody over age 6 months can take a flu vaccine. It does help. Even if it doesn't prevent getting the flu, it does make it where you don't get as sick and hopefully don't end up in the hospital. But that's what's in children's right now. We're having a lot of flu.
Doctor, how do you know the difference between those? I mean, the symptoms are basically the same, are they not?
That's true. We cheat, Paul. We have a little test we run that tells us which one it is. So, and we actually have a better panel now. We used to, in most clinics, in my clinic, we can tell about COVID, flu, and RSV. There are some panels that we can actually run this in our hospital, and Children's runs it, that tells you about 12 other flavors of respiratory viruses.
Sounds like basically this. Will we ever combine the flu shot with the COVID shot?
I hope so. I'm looking forward to it.
Because it seems to me COVID's going to be basically the same thing. It's always ever present there in one form or the other. And and they're talking about boosters. We don't call the flu shot a booster for some reason, but
I know.
We're kind of used now. We're kind of used now to having one every year.
Right, and we may come to that. You have to, as we've talked about before, Paul. You have to remember with COVID, it was so new that we are learning as we go. It's only been 2.5 years. We're still learning. So you're right. If it becomes endemic, which I think the health department has said is become, in other words, it's not really going away. It's not the numbers aren't huge, but they're still there, that they'll work on something where we can combine the two. I'm hoping that they come up with an mRNA virus, mRNA vehicle for the flu virus, because there's a lot of people who are allergic to eggs that cannot take the influenza vaccine each year. And that would not be the case with the mRNA.
Really? Is there some components of an egg in that virus?
No, not the virus, the vaccine.
Well, I mean the vaccine.
The flu vaccine.
Yeah.
If you're allergic to eggs, you really can't take the flu vaccine. Now you can take the flu mist if it's available.
There's no virus, or there's no vaccine for the RSV?
Not currently. It's being developed. It's being tested worldwide, but right now the testing is being done in older individuals and actually in pregnant women in their second and third trimester. And this is important, Paul, because RSV is the most deadly worldwide, and even in the United States, less than 6 months of age. So if moms took a vaccine in the second and third trimester, they actually send protection to their baby that lasts up to 6 months, so that gets them through that bad period. It's being tested right now worldwide, but it hasn't been approved.
Where are we with COVID now? What are we seeing as far as COVID's concerned?
Well, as a practicing pediatrician, we test for it. We're not seeing a lot of it, but again, what's great about COVID, in November 2022 is that there's a vaccine available, but there's also antivirals available, oral antivirals. So if you are at high risk and you get COVID, there's pills you can take, but that's limited to people over age 12 and over 88 pounds.
When you see a child, let's say a year old or around a year old with RSV, and there's no vaccine, what do you do? How do you treat that?
Well, you treat them symptomatically. You treat RSV is getting a lot of press right now because we've always had it. We have it every year. And it's a little bit meaner than the regular cold. It really gets into your lower lungs, causes wheezing, causes a lot of inflammation. And one of the other things that happens with RSV is it lasts longer. We just tell parents, your child's going to be sick a couple of weeks. We want to make sure they don't have any respiratory problems, that their oxygen level's good, that they don't get pneumonia, and we treat that. But you're right. Right now, there's no treatment except for some very high risk people children can receive Synagis, which is an injection they take once a month during the RSV season that gives them passive immunity protection.
Yeah.
From the RSV.
To the parents and grandparents, is it contagious?
Oh yeah. Oh, we all get it. I mean, I probably already had it once this year. I may get it again. I mean, what you have to remember about RSV is it's opportunistic for smaller airways. Okay, you and I have a very large airway, upper airway, and it inflames the airways, and we may wheeze. And we may get bronchitis, or we may get problems, but we're not going to be the same as an infant and child. If you think about the airway of an infant is only as big as the bottom of their little finger. That's not very big. And then it goes down from there. So inflammation is much more serious in them. The wheezing, the twitchy airways are much more significant in them, and they tend to have more problems with pneumonia and complications.
We're talking to Dr. Geri Weiland, who is the Pediatrician and Past President of the Mississippi State Medical Association. Is the flu vaccine we're getting this year? You can answer this when we come back in a second or two. And I want to ask you a couple of other questions, too. Is the when we come back, is the flu vaccine match pretty good the strain of flu that we have this year? We'll ask that question when we return with Dr. Weiland right after this. Hang on.
James is still working, right?
Yes, I do. He's the hardest working man in showbiz, above or below ground. Dr. Geri Weiland is the Pediatrician and Past President, Mississippi State Medical Association. A couple of other questions here. The flu vaccine, does it match pretty good this year?
This year's flu vaccine is matching well. Dr. Paul Byers and the state epidemiologists keep an eye on that throughout the whole flu season. The biggest problem, Paul, is that the flu season came a little early this year before most people took their vaccine. And it's a little bit tricky. If you take your vaccine early, like in September, it's only good, it's only good for so many months before it wears off a little bit. So if you have a late flu season, it doesn't help you. But then in times like this, when we have an early flu season, we have a lot of people that didn't get their flu vaccine yet that are getting the flu. So please, everybody, go out and get your flu vaccine.
Have you any afterthoughts? And I know this was it was just very historic too in the medical field. And we're still formulating those thoughts on the entire COVID situation that we went through, as far as the ages are concerned, the boosters, et cetera, the type of shots. Have you guys sat down and been able to compile some data and maybe change some of the thoughts that you had earlier? I know that's a moving question.
Oh, it is. I think I can only speak for myself. I don't really have data. And I know, what we do in medicine is we always look back. What can we do better? How can we improve what we've got? Where there are opportunities for improvement. I just want to say this, though, Paul. I'm a pediatrician I've been practicing for 40 years. Vaccines, although some people have very strong feelings about them, vaccines have saved lives for decades, going back as far as polio. I mean, we could have a whole segment on this, but when I look at the COVID vaccine, what you have to remember is this was novel, this was new. So what did they do? They went ahead and they tested it first on older people. Those were the people who were having the most. I mean, if you think back to the early days of COVID, the people who were dying were people 65 years and older. It was deadly to these folks. And so the vaccine was first rolled out for older people. And this is what they do. And I think it's actually a good thing, because each step of the way, testing was done on each group. They made sure that it was safe for that group. They found out the exact component that they wanted. Will it change in the future? I think it will. I hope it does, because, right now I've got one for one size and one for the other. And as a pediatrician, that gets hard to keep up with also. But as a whole, I think the whole thing, Operation Warp Speed, we got a vaccine out, Paul, in how many months has this ever happened? And you know what it did? Whatever you want to say politically, it saved lives. It saved lives.
I don't doubt that. I think the politics that were involved, winning and losing and pushing and all of that, complicated the matter. And we would have been a lot better off if we not let politics get involved in this. And I think it's probably the first pandemic we had in history where politics played such a part on the decisions, timeline, everything else. And hopefully we'll learn a lesson from that.
Well, one of the other things is it's the first pandemic where we've had, 24-hour news coverage too, and so much attention that people could put onto this. But you're right, there was too many factors involved.
I always
but it
get
did
this.
Save lives. It continues to save lives. So.
Absolutely, no doubt at all. And once we learned more and more about it, we started targeting it where it should have been. I've often said, if you look back on it now, take everybody over 65 years old, put us on a beautiful island somewhere, and let us stay there and then everybody else go through the herd immunity, and just put us on the island and let us have a couple of year vacation, and then we can come back in safe territory with a shot. But it didn't work out that way. Look, it's always a pleasure having you. I was going to ask you about the news out there that's a little bit scary about all of these local hospitals, these rural hospitals, a possibility over the next year. Many of them may not make it. Your thoughts on that?
Well, this is true. Mississippi State Medical Association had a task force a year ago that reported on this. Dr. Dan Edney, who's now the state health officer, was the head of that. You ought to have him on to talk about it. But, here's my thought on this. We've got to have a short-term answer and a long-term answer, and we've got to find the answers to health care in all of Mississippi because we're a rural state. If you think about this, for interstate highways, we always spend 10 cents on a dollar and take federal funds. We can find ways to take federal funds.
Doc, thank you, sir. Ma'am, appreciate it so very, very much. It's always good. Happy Thanksgiving to you and your family, and I thank you for taking the time. Look forward to seeing you back in the studio.
Say hi to Perez for me, too.
You just did.